Friends, today I'm going to talk about how to consult a doctor. I'm going to talk about the little things that matter from a chronic disease perspective like thyroid or diabetes management. My talk will be divided into three areas. One is before entering the consultation chamber, during the consultation, and at the time of leaving the doctor's chamber. These images, we've just chosen some beautiful images to show entering a place and then some other beautiful images. They really don't have anything to do with my presentation, but just to liven things up. So research to find the right doctor is important. The most famous doctor is not necessarily the best doctor. It's important to use tools like Google and the internet to find a doctor. You might like to find a doctor who has whose views are available and whose views you agree with and whose philosophy you agree with. But many a time, people choose a doctor because somebody they know, either their friend or relative or somebody they know, has actually seen the doctor and has got good care. So if you're a doctor and listening to this, I might like to tell you, it's your patients who bring you more patients. And at the same time, it's important to take an appointment if possible, because then you see the doctor at a time when it's most convenient to the doctor, and then you have time to spend with the doctor. Well, if it's an emergency, you might like to walk into the doctor's clinic and see a colleague, etc. But an appointment is always preferable. We've looked at what to do when entering a doctor's chamber. Let's look at what to do during consultation. It's important to carry all the notes, the reports, the images, and if you do not know whether certain tests or some reports are relevant, it's important to carry them. Sometimes, a test done years ago might be relevant. For example, if a present ultrasound has shown a nodule in, say, the thyroid, and if an ultrasound 6 years back has shown a nodule of the same size, the interpretation may be a little more different from if the previous ultrasound report hadn't been there. So focus on tests that are important. We as doctors are happy to go through paper and documents, but we are also happy to go through mobiles. But remember, sometimes the mobiles can be small in size and the fonts can be small. Chance of mistake is higher. So always carry your reports in a big font format. It could be a mobile, a large mobile, or a tablet, or a news, or a paper document, or something like that. Open up to your doctor. Do not worry about talking freely. So do not worry about the ocean, for the ocean is made of little drops. Similarly, talk freely. Do not worry about the ocean, because the ocean is made of little drops and also has some little hidden gems. So talk freely to the doctor, because once you talk to the doctor, we as doctors are able to find certain nuggets of information that might help you treat the disease better. Also, one of the concepts of motivational interview is that to help the patient talk so that the patient himself or herself can reach a solution. For example, if the patient tells me that, doctor, my sugars are high. Well, I've not been exercising and I've been overeating. And maybe that's why my sugars are high. The patient has thought through the solution and the problem. And when the patient goes through the process of identifying the problem, identifying the reason, and identifying the solution, results are likely to be better. Well, mobile phones aren't really ideal in a doctor's chamber, because when the mobile phone rings, whether it's the doctors or the patients, it can be disturbing. The second point I'd like to make is that if the doctor has asked for tests for diabetes and, say, thyroid disease, then many other reports which are unnecessarily done by the laboratories can be quite superfluous. So avoid bringing reports which are not really relevant to the consultation, because, for example, if I've ordered the thyroid function test and the blood glucose levels and HbA1c, getting to know levels of various other tests which I haven't ordered can be quite distracting and quite unnecessary. So doing unnecessary tests results in unnecessary diagnoses and often unnecessary treatment. So this is a paper which was published, which looked at 8 important points how patients rate doctors. And my rating is that I've given equal importance to all these points. So it's important to address the concerns of the patient. If the patient has come to a doctor So if you're a patient, this is how you should rate your doctor. If you've gone to the doctor for some concerns, and if the doctor has addressed those concerns, then that's good of the doctor. If the doctor has explained the condition of the patient, that's very good. Because it's important to explain, say, diabetes to a person with diabetes in very simple terms. People should be given an opportunity to question the doctor, to participate in the discussion, because treatment is not just about scientific evidence and doctor's experience, it's also about guidelines and patient choices. It's also important to discuss matters in a jargon-free language so that the patient feels comfortable and also patient understands everything. Now, before going, if the patient feels that he or she's got all the information that they wanted, then that's good of the doctor. Finally, as a doctor, we should recheck if the patient or the person coming to you has fully understood what was discussed. And if if your doctor does all these things, addressing concerns, explaining condition, opportunity to question, encouraging you to participate, if the doctor uses jargon-free language, if the doctor has left you feeling very comfortable in that environment, and if the doctor has given you all the information and has also rechecked if you've understood, then that's a doctor you should be appreciating. I say this because I often see reviews on the internet about doctors, and this is one of the ways in which patients can rate doctors, and this is one of the ways by which doctors can understand how people like to assess doctors. So we've looked at before entering and during consultation. Now, before leaving the clinic, it's very important for patients to ask whom to contact for emergency. It's also important to discuss the date of the next visit and also the tests to be done, if any, at the next visit. Finally, as a patient, you should check your medications and tests for the next visit and make sure that you have everything before leaving the doctor's cabin. Of course, you can always go in and ask the doctor again if you've forgotten something, but it's always good to clarify it as early as possible. We as doctors are just coaches, and it is the people with various illnesses who live their little challenges every day. We are, as doctors, supposed to motivate the patient into living a healthy life, but as a person with diabetes or any other illness, people ideally should face challenges like that little extra tempting snack to avoid, or getting out of bed to do that brisk walk, and adhering to medicines. And we as doctors will do our best to motivate you to better health and wellness. Well, so folks, that's the end, and I've talked about 3 aspects of consulting a doctor: what you should be doing before entering, during consultation, and leaving the doctor's chamber. If you've enjoyed these little things that I've discussed with you, I'd like you to put your comments in the slot below, and I'll be happy to interact with you on this. Once again, a pleasure to be discussing this topic with you. Have a great day, friends.